Hello everyone, I have a wonderful patient from Nevada. She is 5 days out from her surgery, and please let me know, how are you feeling this morning?
This morning I'm just a little bit sore, but I have had some notable changes since prior to surgery.
What have you noticed? Like, what have you basically improved upon?
So mostly what I've noticed is I used to have this extreme thirst and pain in my throat, like just extremely thirsty all of the time. That's gone. I had previously been diagnosed with fibromyalgia, and my feet and toes and legs would be squeezing, burning pain, stabbing pains all over my body. I had one cramp. I used to get out of bed every night, at least 7, 8 times a night, cramping so horribly. I had one cramp the day after surgery. After that, nothing. So I can say I'm feeling pretty amazed.
Now, the other question is, I see the color on your face is back. You look healthier, brighter, fresher, as if you got like a facelift or a chemical peel, if you will.
Yeah.
And that, literally, it's amazing to see the before and after. Now, you had what is saline implants, not silicone, and they were not ruptured, meaning these are the saline implants causing you all this misery. And, clearly, without a doubt, these implants, the saline implants, are as worse as, if not worse than, basically the silicone implants, because everyone is given the notion that these are safe. Look, during the 1992 ban, they allowed saline implants, and look, the same set of problems you have, the lady with silicone implants, and the same set of problems, the lady with ruptured silicone implants. And it is very black and white, very defined as far as how you improved upon your set of implants, saline, that you had. Now, one thing that you mentioned earlier, which was very touching, was the fact that you had suicidal ideations as well. Now, please talk to us, because I have heard this from many patients, and sometimes they do not want to talk about it. I thank you very much for talking about it. I think of Tracy Gary, for example, and other ladies who have come forth and testified before the FDA and talked to the masses, i.e. the plastic surgeons and other doctors, about this, because this is a real problem. Depression, anxiety, all these mood instability, emotional instability, along with these psychological factors. Now, this is where everyone else says you need to be on psych meds. Now, please talk to us about that, because it's important for us to talk about this aspect that no one talks about.
So I've had these for almost 19 years, the implants. I've been on psych meds for 10 years now. Each day passing, more and more symptoms, and I just became more and more depressed, to where I did this TMS therapy. I was seeking anything I could, just because I know I was so close to suicide. I wanted to die. And I have young kids, and I just said, like, I don't want to live like this anymore. I'd rather just die. So, yeah, that's where the pain has led me.
No, I know you've gone through, and basically you had the hope. You and I talked, and here you are. Now you have nothing to worry about in the future. You have your only good health. Now, I want you to please talk to us like next month and 3 months from now, just so that we know. Some people might say, oh, well, this could be the tramadol that you're taking. Now, what would you say to the other plastic surgeon or the rheumatologist or the allergy immunologist who's listening and saying this is all in your head, for example?
Yeah, just based off of the last few days and not having those horrible symptoms that I've had, leading up to this point. I mean, I'd be more than happy to come back 3 to 6 months and let you know.
Sure. And if you could unplacebo it, you would have done this already, right? You've obviously had these experiences, and we will see. It's important to follow you, and this is not only you, but the many other ladies in exactly the same situation who have said likewise, that they continue to basically enjoy life, smile again, and basically get that laughter back that you were missing. And so now that you don't have this fibromyalgia type symptoms like you were mentioning, and the freedom from the silicone and implant toxicity. All right, thank you very much for sharing your journey, and we continue to listen. And this is, again, I say, the movement by the ladies, for the ladies. No other group is talking about it to benefit and enhance their quality of life. I wish everyone was talking about it. Now they are on social media, but it's a force that's driven by the women. And I wish this was driven more by the doctors and the plastic surgeons, because this is a real defined problem with a real solution.
I was told that they were safe and they would last me a better part of 40 years. No problem.
No.
So.
Absolutely not true. Yep. So, all right. No, thank you very much for sharing your
Thank
journey.
you.
I will say this, saline implants are as bad, if not worse, compared to silicone. It's like a small snake or a big snake. They both are bad, and they both need to be banned, and this is basically where they belong.
Yeah.
Thanks.
Thank you.
You're welcome.